So I presented the 2-year data of the PATHFINDER study, which is avapritinib, starting at a dose of 200 milligrams once daily for patients with advanced systemic mastocytosis yesterday. Avapritinib is a potent selective KIT D816V inhibitor, which is the mutation that drives 90% of patients who have advanced systemic mastocytosis. And just to put it into context, AdvSM has 3 subgroups within it: patients with aggressive systemic mastocytosis, patients with systemic mastocytosis, and an associated hematological neoplasm and mast cell leukemia. 70% of the patients have SMA gen. So that's the landscape of the patients we were dealing with. There were 107 patients recruited onto the trial. 30 patients had never had any TKIs before, and they had avapritinib in the first line. The rest had previous therapy. And the end result with the overall response rate was that for the whole total number of patients that were evaluable, the overall response rate was 73%. The overall survival has not been reached for any of the subgroups, and 27% of the patients had a CR or a CRh, which means they had a complete remission of the mast cell disease burden or a complete remission with a partial hematological recovery. And those patients who were treatment naive, of the 27 of the 30 patients, their overall response rate was 90% with a 40% CR/CRh. So we saw incredible decreases in the mast cell disease burden, improvement of blood counts, and the overall survival has not been reached in all these groups, which is very exciting.